Hi, everyone, and thanks for listening in to this interview as part of the Canadian Chamber's Business-Led Recovery campaign. The Canadian Chamber's campaign is focused on both providing advice to government on safely restarting the economy, as well as encouraging private sector-led initiatives to accelerate Canada's recovery out of the pandemic. It's a pleasure to be joined today by Hélène Gagnon, who's the Senior Vice President, Public Affairs, Global Communications, and Corporate Social Responsibility at CAE in Montreal. In that role, she manages CAE's external reputation and stakeholder relationship work. Prior to her appointment at CAE, Hélène worked at Bombardier in the mining industry as well as in private law practice. CAE has been at the forefront of the pandemic response and also brings a global perspective to how the pandemic is being managed. CAE also recently had a major milestone that Hélène will be able to speak to in terms of their vaccination role. And I should add lastly too that CAE's CEO, Mark Perron, is also a co-chair of the Canadian Chamber's COVID-19 Recovery Leadership Council. Hélène, thanks for joining us today for this interview.
Thanks for the opportunity, Mark.
So, Hélène, one of the things that I think when people think about CAE, they see flight simulators, but really the story of the company since the start of the pandemic has actually been one of diversification and moving into new areas, particularly in and around ventilators. So to maybe start the conversation, can you say a little bit about sort of what those early days were like for the company and what that early pivot looked like?
Yeah, well, if we go back 1 year and we remember when the pandemic started, aviation basically collapsed, from one day to the next. So our whole market of pilot training just went completely down. But instead of whining, we decided to say, okay, well, society is in bigger trouble than we are. So what is it that we could do to help society right now? Because we're going to face this pandemic. And at the time, there was definitely a need for self-sufficiency, increased self-sufficiency around ventilators, because there was no made in Canada parts, no made in Canada ventilators. And we said, well, you know what? We do have a business where we do training of healthcare professionals. It's a small business, but we said, okay, well, we've never done medical devices before, but we have our engineering capability, supply chain capability, manufacturing capability. And so most probably we could invent, a new design, a made in Canada design, and identify suppliers and do some parts. And that's what we did. Basically, we invented a new ventilator in just a matter of days. We got it certified in a matter of months. So something that would take typically years, was done very, very quickly. And now Canada has built some capability for upcoming pandemics. We have a stockpile of these ventilators. And this pivot actually allowed us, now that we delivered on that contract for the Canadian government, to get other contracts. So now we're doing air sanitizers that destroys COVID and other viruses in the air and on surfaces. So we got this contract from an American company. So we're doing these air sanitizers for Pure, and that's a new business, and we bill 5,000 a month. So these the initial pivot has now opened up a whole new business for us that we would have never thought of, if not for the pandemic.
No, that's great to hear, and I think that story really exemplifies, some of the leadership that we've seen in the Canadian business community with businesses, as you said, not whining, but really stepping up to the plate and saying, what can we do that is not only a way to transition our company's business model, but also a way to give back to the broader country in the service of responding to the pandemic and the health of Canadians that we need to be, mindful first and foremost of. One of the other really great initiatives that your company's been involved with that I'd love to give you a chance to talk about more is in and around vaccinations. And it's great that we've been seeing ample supply coming into the country, but we need as many distribution vehicles as possible to get vaccines into the arms of Canadians. And you genuinely have been a leader, certainly in Quebec, and I think it's fair to say nationally as well in that effort. Could you say a little bit about the coalition that CAE has been leading and what you kind of had to do to make this happen?
So it all started around, I would say before Christmas, when we again, thought of, after the ventilator, what is it that we could do to help Canada? And so we decided to invent a new app to actually train healthcare professionals to do injection of the COVID vaccine, to actually have additional training and train more people more quickly to administer the vaccine. And then very quickly we thought, okay, well, there's going to be a lot of vaccines all arriving at the same time. So at the time we're still, in the limited number of doses, but we thought, what if the government would allow industry to basically administer vaccines on our premises? Because typically, big employers do vaccination campaign for the flu every year. So of course, this is a different magnitude, but we said, we do have some personnel on site, medical personnel on site. We've been organized like this before. And so it started, with my CEO and myself making some calls to a number of around Canada and saying, would you be willing to join us, if we create this industry for vaccination coalition where we're going to ask various provincial governments to allow us to vaccinate on our premises at our cost, so at no cost to the government, really as a social role with our social responsibility to go faster and administer more vaccines to more people more quickly. And so at first, I would say that a lot of governments were just saying, well, we have a problem with supplies. We don't need help. And once we get the supplies, we'll be all okay. And eventually, we were so persistent that the Quebec government said, you know what, okay, you made us reflect. And we think you're right, that we better have a strategy where we have multiple channels, the public sites organized by the governments, the pharmacies, and it would be good also to have vaccination through industry. And so they basically made an announcement at CAE recognizing our leadership. And they since then confirmed 23 vaccination hubs through industry. And I'm very happy to say that as of today, we've vaccinated already 10,000 people at our vaccination site. So this is a big milestone in just a few weeks. And now that supply of doses is increasing. I think next week we're going to vaccinate more than 5,000 people just in 1 week. So, I mean, we're really ramping up. And the fact that, especially in Quebec, we'll have those 23 vaccination hubs to industry is, going to multiply the number of doses that we could inject in people and restart the economy, because that's all this is about, to be able to get a new sense of get back to some level of normal and restart the economy, doing it safely and respecting the order of priority of public health. But I think now, we're in mass vaccination, and our role is a difference, I think.
Well, and I think, Hélène, that's, fantastic story that you've had going from, the first 10,000 to the next 5,000 coming, quite quickly. And we're getting more doses in. Canadians are talking more about the second dose. And I think we're really going to want to see what you do to get to the next 10,000 and the next 10,000 after that. So what are some of the lessons learned that you've had from the first wave that you think you're going to be applying going forward as CAE continues its participation in this vaccine rollout?
So I think, whether it's CAE or the other companies, we've not been working on this alone, to set up the vaccination centers. We had to work in conjunction with the public health. So in Quebec, it's the CIUS, so they're kind of the regional health authority. Each vaccination hub is paired with a CIUS, so we've had great collaboration. So I guess it's going to be us working together for the second dose to try to advance some of these appointments if there's more doses coming in. And that was the whole point of having additional channels to distribute the vaccine, is to make sure that when the supplies would come in of all these doses of vaccination, people could go fast and get an appointment fast, whether it's at the public site in the pharmacy or on an industry premise. And I think now that we will have the 23 vaccination hubs from industry going, some of them are opening in just a few days, is going to add additional capacity. And so perhaps the second dose will be able to be injected much faster in the population. And so that should be good to help us restart the economy, hopefully reopen the borders and get people flying again, so that we can restart training the pilots and the flight simulators right behind me.
Absolutely. And I think, everyone agrees that the vaccines are going to be the long-term solution that gets us out of this. But nonetheless, I think over the short and, even the medium term, rapid testing will continue to be a tool that is used in the workplace and perhaps even consumer settings. From the standpoint of CAE, when it comes to workplace rapid testing, or I guess rapid screening as it's more correctly called, what's been sort of your experience, and what do you see as the way that that could be, deployed? Certainly, a lot of our listeners are participating in the Canadian Chamber's Rapid Test Initiative, and they want to be able to do this. And so, what are some of the lessons learned, do you think, from your experience, and as a large employer, what do you see?
Yeah, so we think it's been very helpful. So it's been easy to access the test kits or the rapid screening tests. It's not complicated to set up. So we started the rapid screening at our Montreal headquarters at the end of March. So in just about 6 weeks, we conducted 3,000 tests, and we found 2 cases with no symptoms of COVID. So this is good because that's exactly what the rapid screening is supposed to do, is to catch those people that have to go to work and are unaware that they have COVID. And if you can actually catch them, isolate them, then you can prevent COVID spread in your workplace. So it's an additional layer of protection for employees and their families, and it's really complementary to the PPEs and the vaccinations. So we've been finding it very helpful. It's not invasive. It's a really quick test. So, employees are willing to do the test because they know this is an additional layer of protection. So it's been so successful in Montreal that now we decided to add additional sites in other provinces. So we've added a new site in Moose Jaw where we have CA employees, and we've conducted a few hundred tests already, all negative for now. And we're looking at perhaps adding a clinic at our flight training center in Toronto in conjunction with Air Canada. So for now, we're really looking at expanding and adding more sites to do the rapid screening, because we think in the long term, it's good that we keep that additional layer of protection.
Yeah, absolutely. Well, Hélène, thanks very much for making the time to appear on this business-led recovery video segment. And to our listeners, stay tuned for future segments. We're going to feature more members of the COVID-19 Recovery Leadership Council to have some best practice and tips that you can learn and apply in your companies.